Have Paige, Figi, Angie Weaver, Christy Pauling, Angela Guerin, who may or may not be here. Okay, she's not here, and Martha Schultz. And if you would join Representative Moline, that would be great. And if you could introduce yourself for the record, and welcome to the committee.
Thank you, Madam Chair, members. My name is Paige Figi. I'm here from Colorado. I'm a mother. My daughter is Charlotte. She has Dravet syndrome. There's a couple kids here that also have the same syndrome. It's a severe intractable epilepsy. 2.5 years ago, we ran out of medical options. We pursued a strain of cannabis, high in cannabidiol, low in THC, a non-psychoactive strain of cannabis. Treated her. She was end of life. She didn't have much longer to live, and with nothing left to try. And it worked. And it was sort of this miracle story. And there's this big following nationwide, worldwide, around this backdoor research, I guess I'd call it, because we didn't go through FDA trials and because we couldn't. And I know that there are some happening, but it's extremely difficult, the red tape, to study this plant. So they named the strain after her. It's Charlotte's Web. We run a nonprofit in Colorado supporting the people growing this medicine, supporting the parents moving that are leaving Minnesota to move to Colorado to get access to this medicine. So I'm just here to explain my role in the company, explain what I'm supporting these parents, whatever they're asking for to get access to this plant. I'm in support of, because I'm a success story, and I'm seeing hundreds of these children in Colorado, a success story. So what we're seeing is an 85% efficacy rate on pediatric intractable epilepsy. 85% of the children trying this medicine have a 50 to 100% seizure reduction. So it's just, I think what we'll see very soon here is that it's just the next epilepsy treatment. It needs to be studied, and that's always been my drive, is to have good science on this, because there is so much red tape. I am very much in support of what is happening in Minnesota to back that. It is going to take a long time, so what our organization is doing is we're doing the research ourselves, the double-blind placebo clinical trials in South America, so that we can have access to faster data. We're retrospectively studying these patients. We're doing prospective studies. We have the world's top epilepsy researchers paired with us as our leading these trials. So what we do in Colorado in the meantime is we support the patients that are moving there for medicine. We keep the price at a nonprofit price point. That doesn't go above 5 cents a milligram. It's lab tested. We have our own Pfizer chemist, our own laboratory, and then that's not good enough, so we actually send the medicine out that they order and to a third-party lab. So we get an objective, blind third-party laboratory checking the medicine. And so we're kind of setting the standard for this whole industry and this medicine, because we're seeing it's working, because we have demand. I think our wait list is 10,000 pediatric patients right now. Worldwide. We're represented. 50 states have moved to Colorado. 43 countries are on the waiting list, and we need to expand access to this. And so I'm just offering our organization to our transparency. So if you have questions or want to look in or ask what we're doing or look at our data, I just want to make that available to you. The rules and regulations in Colorado are pretty stringent for medical marijuana, and we have the people who've written the law and who've worked with the regulation are available as well. They've been there and done that, and they can offer their expertise. If you're stuck in the law enforcement side of things, you can run this in a very cautious way where it's highly regulated. So, for example, our grows are inside. Our medical marijuana grows are indoors under glass, greenhouses, and they're video surveillance, 24-hour video surveillance, laser, security. So there's a person there 24 hours a day. Things like that we haven't written into the law, but we have done this not only because it's from a law enforcement perspective that we want to keep this from being abused. This particular strain of plant that we grow, and we grow many, but this is 80% of our production is Charlotte's Web. We want to keep it protected. This is a non-abusable form of cannabis, so the abuse potential is not there. It's not an issue. We do grow THC, high THC plants for cancer, and that's such a thing. And we do sell that in a smokable form. Charlotte's Web is not sold in a smokable form. So there's really no abuse with that plant, but we still are very protective of our situation. So we have, these systems in place to keep this cautious and secure, and you can do the same thing here in Minnesota for your patients that are asking for it so they don't have to move. And then the ones that have left who can't be here, the medicine cannot leave Colorado, can come home and have this. So I just want to offer that support for this bill, and hear if you have any questions.
Thank you, Ms. Figi. Representative Purcell.
Thank you, Madam Chair. The various combinations, chemical combinations, patent protected now that you have?
We have trademarked it, we have patented the process, and we're trying to patent the plant profile because we keep it extremely consistent. The patients, this is a seizure drug, you can't stop and start, you can't run out, and you cannot change the consistency. So we're working on it. It's a long process, but we've begun that process.
Are there other questions?
Madam Chair,
Representative Moline.
I just wanted to provide some comments regarding, because I often get asked, well, Charlotte's Web has been such a success and they have a waiting list of 10,000. I know a couple hundred of those are from Minnesota. I know there's people in the room that are on the waiting list to get this medicine in Colorado. So I often get asked, well, why can't we just bring that medicine here to Minnesota? And what I respond is I wish that we could do that. But federal law prohibits us from getting that medicine to Minnesota, which is why we carefully crafted this bill to allow it to be manufactured in Minnesota. I mean, it's absolutely necessary to have a successful medical cannabis program to be able to grow it in the state. So if we lived in the perfect world, we wouldn't have to have 10,000 kids on a waiting list, and we'd be able to get that medicine to the states or countries where it needs to go. But unfortunately, that is not possible under federal law, which is why we are establishing a separate program here in Minnesota. But I think, I would encourage members to, read the story of Charlotte's Web and what they have had successes with in Colorado, as far as not only seizure reduction in these kids, but these kids are actually regaining some cognitive skills that they had lost as a result of the amount of seizures they were having, bringing back their ability to speak and ride bike and play. And I think those are some pretty miraculous results that, these kids have not obviously seen with traditional pharmaceuticals. And so, if members have time to look into some of that on their own, I think that they would be surprised with some of the results that they're having. And I want to thank Ms. Figi for coming all the way from Colorado just for our hearing today. And I know that she has a flight out this evening, but she will be around for a little bit if members have any other questions of her and their experience in Colorado.
Representative Moline, Ms. Figi, I did have just a couple of questions, and I would love to visit with you when you're done, and thanks for coming to Minnesota. I am wondering if you can talk just a little bit more about the lab aspect that you were talking about, and with respect to the quality control in terms of the medication, its dosage, and if you could just walk us through that,
Sure.
That would be helpful.
Thank you, Madam Chair. What we do is we lab test it on an HPLC. It's kind of a common machine that you would use to do this sort of thing. And we have to have a standard that, again, we've set. There's not a rule for this, but we've set the standard for the children, that it has to have that consistency, and it's destroyed if it doesn't. And then we also send it out to a third party. So we cultivate. It's a vertical integration in Colorado. So we cultivate, we manufacture, and we dispense 70% of what we grow. We have to dispense our own. So we are we are in control of the Charlotte's Web strain, and we grow that. We lab test the plant, the dried plant, to make sure it's oil makeable into an oil. And then we test the oil, and then we offer different milligram per milliliter solutions, different concentrations. And they're all lab tested at our lab, and then they're third-party lab tested as well. The dosing protocol, it's actually the same dosing protocol that I came up with when Charlotte was the first child in the state of Colorado to do this. the first young child. And we just, I looked at research. We came up with the dosing protocol, doctor supported, research supported, and it's still the same dosing protocol that parents are finding that works. And everyone fits into this bell curve of therapeutic range of milligrams. And we base the doses on milligrams per pound body weight per day. And we're not doctors, so we're not prescribing this or telling, or we're not running a clinical trial in Colorado. We can't do that, but we are making a suggestion saying this is what is working. And we're finding that the children fall into a therapeutic milligram per pound range. It's backed up by the studies happening right now with GW Pharmaceuticals. It's backed up by the research and published medical articles for decades. And we're tracking that patient base with our doctors that are following us right now, and more are coming on board. We have the backing of the epilepsy foundations and neurologists, and so it's a working therapy. The safety of this is well documented. It's a well documented safety profile of this plant. In 5,000 years of use, we haven't seen an overdose, and so we need to learn more about this. The patients that I'm speaking to are kids that aren't going to live probably to adulthood. I don't mean to be insensitive, but these are kids that don't have many options. This isn't a gateway drug for these patients. This is actually, for my daughter, it was an exit drug. It got her off of all of her pharmaceuticals, possibly the first Dravet kid on the planet to be this long pharmaceutical free, 2.5 years almost now. So we are very cautious. We're very consistent. We want the research. We are in it for a nonprofit. And I think that that's just the way it needs to be done. What the patients do when they come in, they start in with our nonprofit. They don't walk into the store and perhaps their medicine is there that day. They order it, and they are guaranteed they will not run out of medicine once they start with us. We'd rather have that system and a wait list than a potential running out of a seizure drug. So we're very, very cautious, mainly because the volunteers like myself who are running this are mothers of children, and we have a bar that is much higher. So we're somewhere in between a pharmaceutical company and an herbal supplement, like a food supplement, and we treat it that way.
I just have one more question for you, and that is, how is Charlotte?
She's amazing. She's off oxygen. She's off her feeding tube. This is a child who was like 1 month old, catatonic, seizing every 20 minutes. She has 1 or 2 a month, 99.9% seizure control for over 2 years. And she can walk again. She can talk again. And she has a twin sister, so she has her life back again. They are friends again. And it's been shocking. It's noteworthy. It's worth fighting for. It's a medical treatment. This information was not reaching me before. We're a conservative family. My husband was military, and he's in Afghanistan right now, actually. And it's the medical marijuana industry was not reaching me as a medicine. I was seeing the abuse. And it really turned my mind around to see my child wake up from this catatonic state. And now I'm out here advocating. I never in a million years would thought I'd be sitting here at a marijuana hearing, but it works. And these are parents who don't even go on vacation. They don't go on their Make-A-Wish trips. These kids are too sensitive to even be in this room right now. And it's worth fighting for, and that's why they're here.
And Representative Purcell, and then we're going to hear from the families as well.
Just a point of clarification, I thought I heard the acronym high performance liquid chromatography was your methodology and your instrumentation, eh?
That's correct.
Representative Norton?
Yes, thank you very much for your testimony, and it's quite compelling, and I'm very appreciative for all the work you've put into this. One of the things that seems missing from your bill, Representative Moline, I hate to even mention this because I know you've worked so hard to get it where it is right now, is an issue that has come up, which is the federal government is still a barrier for the states. And so I guess I would like to suggest that perhaps, if it's appropriate, that someone who works on language might put something in here that the Department of Health lobby is not the right word, but write a letter to the federal level, encouraging them to lift the restrictions. Rather than just waiting and hoping it happens, let's ask them to do it. So I would just suggest as you move ahead, you might add that in here.
Thank you. Representative Hansen.
Thank you, Madam Chair, for the indulgence. And it seems to me, listening to the testimony, And I think I heard you mention 2 or 3 times you were a nonprofit. Is that correct? So it seems what you're talking about is the democratization of care to the public. Rather than having this be about money and delivering of medicine, the suite of chemicals and chemistry that's approved for patients, that this is something that you were able to do on your own for your child, and that you're not alone. And that seems to be the kind of the crux of the issue here. We have the federal government that will not allow certain things, and we're debating whether we as the state should allow certain things. But a key thing that you've told me is that you're a nonprofit. So I would say that your motives are pure.
Thank you very much for being here in Minnesota. I hope you're enjoying your stay.
Thank you.
You're welcome. Angie